So I thought I'd start with a bit about me. So clinically, I have worked as a specialist podiatrist in Hampshire and Isle of Wight Healthcare NHS Foundation Trust, formerly Solent NHS Trust, since graduating from the University of Southampton in 2020. Currently, I'm on my predoctoral clinical academic fellowship, or PCAF. I started this back in September last year. My award runs for 2 years at zero point 0.5 work time equivalent. My host organisation is the NHS Trust that I'm employed at, and my partner organisation is the University of Southampton. I'm a member of the Optimisation of Musculoskeletal Foot Health for Active Living Research Group at the University of Southampton, and our research group's aim is to enhance musculoskeletal foot health to enable lifelong active living. And this aligns with my research area of interest, which is variations in foot insole access and prescription across the UK. And I'm also an internal examiner and invited lecturer on the undergraduate podiatry programme at the University of Southampton. So I thought I would talk a bit about how I've got to the stage where I'm at now on my predoctoral award. So after graduating in 2020, I've been awarded several research awards, helping to build my research skills, networks, and my clinical academic career ambitions. So firstly, I undertook an 8-week full-time allied health professions and nursing internship with the charity Versus Arthritis, or now Arthritis UK, working alongside clinical academics at the University of the West of England and Bath Centre for Pain Services. I led on a scoping review investigating access to chronic pain services for adults from minority ethnic groups. I presented a poster abstract at the Versus Arthritis 4th Annual Pain Conference and published 2 papers as lead author. After this, Professor Catherine Bowen, who's Professor in Podiatry at the University of Southampton and who also led the Versus Arthritis Allied Health Professions and Nursing Internship Programme, reached out to me with an opportunity to work as a research assistant on a UKRI-funded foot insole project, where I undertook patient public involvement and qualitative focus groups with patients prescribed foot insoles and podiatrists prescribing them for musculoskeletal foot pain management. I presented a poster abstract at the Versus Arthritis Centre for Sport Exercise and Osteoarthritis Research Conference and published a qualitative paper in the Journal of Foot and Ankle Research. In 2023, I was the first podiatrist to be awarded an NIHR Applied Research Collaboration Wessex Researcher Initiation Award, and I was seconded 1 day a week for 6 months to work on a project of my own design. The UKRI-funded foot insole project I worked on during my secondment really interested me, and I wanted to build on this work. So during my ARC Wessex Award, I undertook focus groups with adults aged over 65 using foot insoles for foot pain, and presented a poster at the ARC Wessex Collaborating for Impact event last year. After this, I was awarded another 6-month research award, but this time with the Academy of Research and Improvement within my NHS Trust. This afforded me time to undertake a feasibility study of a podiatrist survey mapping foot insole provision and also help prepare my PCAF application. And finally, I'm here, having been successfully awarded my NIHR PCAF award and having the time to undertake training and development and work with people and communities to support a PhD application. So in terms of what motivated me to apply, so I first heard about the clinical academic pathway through my Versus Arthritis internship. Through this internship, I was able to attend a variety of sessions with clinical academics across various higher education institutions across the country. At the session I attended that was hosted by the University of Leeds, I heard from another clinical academic podiatrist, Dr. Richard Wilkins. He gave a presentation on his NIHR Clinical Doctoral Research Fellowship, so CDRF, or what's now the Doctoral Award, investigating hemarthrosis of the ankle in haemophilia A and B, and how he got to that point in his research journey. Professor Catherine Bowen was also a point of encouragement, given her background as the academic career development lead for NIHR ARC Wessex, and she's provided me expert supervision since I began my research journey. Other reasons I applied included having to listen to patients' anecdotal experiences of having foot insoles prescribed for musculoskeletal foot pain and the challenges they found with this. The current literature shows there are high consultation rates for foot and ankle musculoskeletal problems in the UK, with 15 to 36% of people experiencing foot complications. And foot pain is a known risk factor for weight gain, reduced resilience to chronic conditions, social isolation, disability, loss of independence, and lower quality of life. There's good evidence for the efficacy of foot insoles for musculoskeletal foot conditions such as arthritis, but poor patient experience, low satisfaction, increased pain, and frequent adjustments have been shown to affect the efficacy of foot insoles and patient satisfaction. In my qualitative studies during my research secondment and my ARC-Wessex Award, participants called for clearer access pathways and process improvements, while clinicians highlighted the need for standardised prescription language and better communication with manufacturers. Therefore, I wanted to take my preliminary work that I completed during these research secondments, the ARC-Wessex Award and my Solent Discovery Award forward. I wanted to have the protected time to develop a competitive doctoral award application and undertake a tailored training and development plan to help me achieve this. And ultimately, because I'm committed to a clinical academic career. So during my NIHR ARC-Wessex Award, I started to think about and make early progress with my NIHR PCAF Award application, which I continued during my Solent Discovery Award. Firstly, this included creating my NIHR Aramis account, though now a different award system is being used, and populating this with my CV and general information, and also ensuring that my ORCID ID was up to date. The next stage was speaking with potential supervisors. I already had a primary academic supervisor and secondary academic supervisor through my NIHR ARC-Wessex Award, who agreed to continue in their roles during my PCAF. I needed to find a clinical academic mentor, and the academy at my trust were able to support with this. Once the members of my supervisory team were established, I then had to make sure that they all had NIHR accounts and their ORCID IDs were up to date, and also provide them with a timeline for submission. I also needed to contact my higher education institution, as they had their own processes I also needed to follow, including things like arranging a professional services review and requesting sign-off from the head of school. Early on, I began preparing the section of the application, which is now your narrative CV, and putting together an outlined research plan with help from my supervisors. And I started to think about potential collaborators in academia, clinic, and industry that would be useful during this award. At this stage, I also reached out to the Research Support Service, who helped review these sections and discuss my PPI plan, or what's now your Working with People in Community summary. I worked with my supervisors to develop my training plan, and once I had a well-prepared application, the Research Support Service arranged a review of my application, and this gave me time to refine it before submission. I also asked the head of the academy to write my host letter of support and my higher education institution for specific information required on the letter, so things like evidence of how the organisation supports early career researchers. I chased my trust for a finance officer who helped me to complete the detailed budget section of the application and approve this for me. I scheduled time with the head of the Academy of Research and Improvement at my trust and the head of school at the university, who were the signatories for my application, to sign off a week before the deadline to ensure there were no added stresses. I booked in a date with their personal assistants with plenty of time in advance to ensure this, and then in March 2024, I submitted. So now I thought I'd just talk a bit about how I've actually been finding the award, given I'm now just over a year into it. So in short, it's been great. It's an opportunity you'll never get again, so definitely make the most of it. It's so good to have my entire Wednesdays and Thursdays and my Friday afternoons dedicated to my PCAF award. I'm currently using the time to focus on developing my doctoral award application. But within my first year of the fellowship, I've been able to produce a poster abstract for the Royal College of Podiatry conference and have a feature that's currently under peer review in the Podiatrist, which is the professional magazine for the Royal College of Podiatry. I have fortnightly supervision with my primary and secondary academic supervisors, monthly supervision with my clinical manager, quarterly supervision from my clinical academic mentor, and we have also had an annual joint meeting to discuss my progress and trajectory, which has been really useful for making sure everyone's on the same page. Having this protected time has also afforded me opportunities to contribute to the development of others through supporting research applications, mentoring NIHR South Central Insight Programme Masters in Research students, lead research methodology sessions in our Podiatry Journal Club, present at Academy of Research and Improvement Research and Development training days, and contribute to the wider research community through developing the Optifar Patient Public Involvement newsletter, and sitting on the Academy of Research and Improvements strategy group for patient and public involvement, and also contributing to broader society through undertaking community engagement events with adults in Wessex living with foot pain and educational foot insole workshops with people seeking asylum in Portsmouth. So I thought I'd talk a bit about working with people and communities, as this is a really important part of your application, especially if you want to go on and apply for a doctoral award. So during my PCAF, I organised 2 meetings of 20 adults with musculoskeletal foot pain across Wessex to discuss foot insole research priorities and key foot insole resources. I formed a clinician advisory group consisting of 4 podiatrists working in the NHS and private sector who prescribe foot insoles, and a patient partner group consisting of 4 adults with experience using foot insoles for musculoskeletal foot pain. I met with the group on 3 occasions, each lasting an hour, to discuss my research design, recruitment and dissemination strategies, and review my plain English summary. You can apply for up to £1,000 through your predoctoral award to undertake these activities. I also received additional funding through the NIHR Research Support Service and utilised existing community engagement events my research group at the university were running to complete these activities. One of the most beneficial parts of the predoctoral award, in my opinion, is the tailored training plan you put together. Within my first year of the fellowship, I have completed research training with University College London in research methods and statistics, the University of Bristol in questionnaire design application and data interpretation, and I've also completed a mixed methods master's module with the University of Birmingham. And this has all directly informed the study design and analysis for my intended PhD project. I've also completed formal equality, diversity and inclusion training with the Centre for Ethnic Health Research to support my community engagement activities that I discussed on the slide before. Through the predoctoral award, you're also given the opportunity to attend conferences up to £1,000. For my clinical development and networking with industry partners, I've utilised this to attend the Run 3D Biomechanics Masterclass last month. And I will also be attending the annual Royal College of Podiatry conference in Glasgow next month, where I have an abstract accepted. I will use this as a platform to raise awareness of the predoctoral award in podiatry, and also use it to try and help build my clinical and industry networks further. During my final year of my PCAF award, I'll be undertaking research placements with higher education institutions in the country with expertise in foot insole research and health inequalities. I'll also be undertaking industry placements with 3D print companies and business strategists to help prepare for my doctoral award. In terms of my clinical development, as remember, up to 20% can be dedicated to this. I have spent time shadowing an NHS consultant MSK podiatrist to learn how he applies his clinical reasoning to his foot insole prescriptions. And I will also be shadowing podiatrists who prescribe foot insoles in the private sector to gain awareness of differences in prescription processes. I'll also be shadowing other allied health professions who prescribe foot insoles, including orthotists, to understand how their processes differ to those in podiatry. So I also thought I would talk about some of the challenges I faced. So firstly, in terms of preparing my application, I found it very hard to pin down my finance officer and get responses. Messaging and calling via Microsoft Teams helped with this, rather than trying to communicate through a string of emails. I had to wait a while before finding out the decision of my application. So I did email the NIHR Academy a couple of times to chase the outcome. But with the changing of governments in July 2024, this caused a delay in finding out the outcome. But I was pleased when in August I found out I was successful and was able to start my application, start my award straight away on the 1st of September 2024 as intended. Once I'd started my PCAF, I then had to have my contract changed as my host organisation merged with 2 other trusts to become a new trust, Hampshire and Isle of Wight. My primary supervisor also went on long-term sick leave, so I had to find a new primary supervisor. But luckily, due to my involvement in the active living research group, and with guidance from Professor Bowen, I was able to secure a new primary academic supervisor, Dr. Charlotte Dando, who's an MSK researcher, clinical academic podiatrist, and current NIHR fellow, who's delivering the pre-recorded session that's going on at the moment. I went to the NIHR Academy early on to advise them of this change, to ensure this would be agreed and changed on the system. And finally, one of the training courses I'd planned for my professional development was no longer running, so I went back to the academy with a proposed alternative, which was agreed. So some top tips that I would give to anyone considering applying for the Predoctoral Award would be to create your NIHR account early on, as this will save you time in the long run. Read the application guidance thoroughly and think, are you eligible? What do you need to include? Who should I approach to be my supervisors? And leading on from that, don't underestimate the importance of a good supervisory team. I think, what are their skills and experiences? Do these align with each other and what you want to get from them? And what will your supervision look like? Be transparent with your clinical managers, with your career ambitions, and work with them to negotiate work time equivalent and emphasize the benefits of you completing this award for your team, service, and trust. I would say sort out finance as soon as possible so you can add them to your application. But it's also important to think, have you got enough experience or are you overqualified? And is there a clear trajectory to maximise your chances of success? Reach out to the NIHR Research Support Service for support and guidance early in the process to allow plenty of time to review your application and speak to the right people. Have a feasible plan and Gantt chart for your award to ensure you keep to time and target, and make sure your combined letter of support from your host and partner organisation is tailored to you and how they will specifically support your clinical academic career thereafter. So some things that I think are important to remember, which I'm sure have either already been covered or will be covered during the course of the series of webinars, are to look at the assessment criteria, as you'll be scored out of 6 for each area. The reviewers will rank you as a candidate, so you need to get across your commitments to a clinical academic career, your previous experience and plans for the future. You'll need a comprehensive training plan to develop both your research and clinical skills. Think about collaboration. So who could you collaborate with during your award outside of your institution or your profession? The finance section is quite a long one, so make sure you know who your finance officer is and what information you need from them. You'll need a joint letter of support from your host and partner organisation that needs to be tailored to you. And there is an emphasis on research inclusion and working with people in communities at all stages of the research process, including the application phase. So now to end, I just thought I would finish my story with sort of my next steps. So these include continuing to prepare my NIHR Doctoral Award application and then hopefully submitting this, presenting my abstract at the Royal College of Podiatry conference, as I've mentioned, undertaking the research, clinical and industry placements that I've also mentioned on the previous slide, and starting to prepare my ethics application as well.